I think personally, one of the most important things that I have learned from doing this engagement with our communities is that we need to get out. And when I say that, I mean out of our hospitals, out of our offices, to actually speak to people where they meet. So rather than making events that will be held in a hospital or, for example, in our community centers, I think it's very important to meet where people already congregate. So, for example, the mosque was a really good example and a place where people feel safe. The other thing that personally for me was important was to meet with people that the community trusts. So, voluntary sector organizations are really key in reaching our communities because our communities already trust them, they already access them for service. So we do need to find out what community organizations, what community groups are happening out there, and we need to reach those populations. So that was one of the most important things that I've learned. I've also learned that you have to be starting with the voices of women when you want to develop services. It's very easy for us as clinicians to make decisions very early on in our services and then going to ask people. For me, this completely turned engagement around. And actually, my biggest takeaway from this project is that you always need to start with the voices of people, particularly those who don't always have a chance to speak up. Yes, I definitely will do a lot of things differently if I have the chance. I think my biggest mistake perhaps was not to involve the engagement team earlier on, just because I didn't really know that existed, to be honest. So for anyone who is planning to do any engagement event or going out in the communities, I will reach out to our comms and engagement team because actually they do have a lot of connections and a lot of tips. So I will be engaging them early. And if I have more time, obviously, I will continue doing the engagements throughout the project. So what I would really like to do now, for example, is to go out into those communities and see what difference has it made to them or to their lives since we started the pilot.